Fitness Friday, everybody. This is Janet Randall, and today I'd like to talk to you about some exercises that will help strengthen your knees. Many times when we start to experience knee pain, it makes us want to avoid all lower body exercises, when really those are the things that will help strengthen and support your knees, hips, and ankles. Now, every circumstance is different. Everyone's individual. If you're experiencing chronic knee pain, make sure you check with your physician before you continue with your exercising to make sure you're doing what's best for you. Before we get into our exercises, I want to talk a little bit about myofascial release. A lot of times knee pain can be a result of tightness in our calves, our hip flexors, our IT band, and that will help. That pulls things out of alignment, takes things out of balance, and then causes pain in the knee. So let's talk about how to release those tight calves. We're going to start with, I got a lacrosse ball, but you can use a tennis ball, or for calves it works well with your foam roller. Let me show you how the lacrosse ball works. Sit on the floor, go ahead and set your leg on top of it. You want a little extra pressure, cross the other leg over, roll back and forth a little bit till you find a tender spot right there. And you're going to go ahead and just point your toe up and down for about 30 seconds, right there on that tender spot. Make sure you hit both sides. This is a practice that can be done before exercise. It can be done after exercise. It kind of depends on the person, what feels best for you. Each of these practices can be done for about 30 seconds each, up to 3 times. After your calves, let's talk about our hip flexors. These are especially tight if we do a lot of sitting with our job or throughout the day. I've got another lacrosse ball here in the toe of an old sock. I'm going to slide this one down. Squeeze it down there and then tie it really tight. Our hip flexor is a little bit larger area, so we need more than one ball to help hit that. So right here below that hip joint, you're going to lay on your stomach, place the ball right there in that hip flexor. You're going to bend your knee on that side and just kind of wiggle that leg back and forth. Finding the spot that's really tight. You should feel it. You can adjust as needed. Again, 30 seconds. Make sure you hit both sides. Right there, kind of at the top of your quad, under your hip joint. Just wiggle back and forth. Helps open up that hip. All right, moving on, we're going to do our IT band, iliotibial band. It runs from our hip down to our knee. For this one, we're going to use the foam roller. It can be a little tender area, so to help modify, you can bend your top leg and just put your foot on the floor. Your elbow right here on the other side, and you're just going to roll back and forth between your hip and your knee. Not right on the joint, just in that space in between. If you feel like you need a little more pressure, go ahead and stack those feet. Right there, rolling back and forth for about 30 seconds. And then you're going to flip over and get that other side. This really helps to, stretching is great because it'll elongate the muscles, but when we're having some tightness and some muscle imbalance, we want to really release, we want to activate those tight muscles so that they can release and relax. And hopefully make our knees feel a little bit more comfortable. Okay, that's our goal. All right, moving on to our exercises. We have Romanian deadlifts. This is a straight leg deadlift. Knees are soft. Hips, the motion happens right here in our hip joint. You can go ahead and put your fingertips behind your head or keep them right here on your waist. Here's the thing, as we're hinging those hips, we're bringing our shoulders are coming forward. Our hips are actually going to push back behind us. We want to keep our torso nice and strong and straight. Roll those shoulders back. Pull that belly button back towards your spine. Knees are soft. Hips hinge. To initiate the stand, we're going to squeeze your glutes and hamstrings. Right there. Strong squeeze at the top. Not an arch. Just a strong squeeze. So push those hips back. Squeeze. Push back. Squeeze. We want to increase the intensity. Go ahead and grab your weight. I call this a baby hold RDL. You're going to hold it right here nice and tight. Just because we're holding that weight does not mean that we should round those shoulders. We're going to roll it back, still nice and tall, belly button pulled in towards our spine. We're going to knees soft, hinge it forward, engage those glutes and hamstrings, strong squeeze at the top right here. Abs, quads, glutes, hamstrings, squeeze. So hinge, squeeze. Don't drop your baby. Keep it nice and close. Now, if you are comfortable with this hinging motion, and you can keep that nice, strong, straight torso, keep the motion in that hip joint, not in your back. Grab one weight in each hand. Shoulder blades roll back again. Hinge, squeeze those glutes, hamstrings, strings, stand up strong. for this would be 3 sets of 8 to 12 reps. Okay, next exercise I want to talk about is the goblet squat. It's one of the basic forms of a squat. You're going to take it with, you've got one weight right here in front of you, holding it on the end cap right there under your chin and your chest, shoulders back. Holding this weight right here engages that core to help offer support. Anytime you do a squat, feet are about hip width apart. Toes can be slightly turned out, that's fine. And we want to make sure that our hips drop down and back as we squat. Push through the ground, push through our heels all the way through the ground. Stand up strong, and again, strong squeeze at the top. Keeping our chest nice and tall. As we push our hips back, keeping that pressure in our heels, it keeps our knees right where we need them, right over those ankles. A lot of times if we come forward on those toes, it puts a lot of pressure on the knee, lots of pain. Another thing that I see sometimes in a squat is that the strength is not there. We've been sitting for so long, we have so much tightness that our glutes are not activating. And so as we squat, those knees will come towards each other. Again, causing pain and discomfort in your knee. To help us activate those glutes and keep those knees where they need to be over those feet, we're going to do what we call reactive neuromuscular training. It comes from Greg Cook. It's almost like we're going to feed the bad movement. Okay? If you have access to a resistance band, or you can even have a friend or something help you out, what you're going to do is I'm going to tie this band here around. What it will do is when I go to do a squat, the band will push against my knees, trying to push them in, and my automatic reaction is to engage my glutes, fire those glutes, and push my knees against that resistance. Kind of reacting, training my body to do what it needs to do so that I can get the squats in the right place. Okay, so I've got my resistance band on here, feet out, nice and tall. So as I squat, I automatically, my knees are pushing against that band, firing at those glutes, activating those glutes to keep those knees right where they need to be. So let me show you from the side. Again, nice and tall, push through the ground, strong squeeze at the top. Okay, another great way to incorporate this RNT, reactive neuromuscular training, is with a reverse lunge. Again, a lot of times from injury or tight muscles or muscle imbalance, as we step back for a lunge, that front knee wants to come in. Well, to help fire those glutes, we're just going to, you can have a friend kind of push against your knee if you need to, if you don't have a resistance band, or you can tie the band around that knee, anchored on somebody that won't tip over. You can hold the weight just like you did for your goblet squat, or you can do it without a weight. So we start with our feet about hip width apart, shoulder blades roll back, pulling that belly button towards our spine, step back in that reverse lunge. Right there, stay on that same side for 8 to 12 reps, and then you'll switch sides. Again, engaging those glutes to pull that knee out. Another great way to help strengthen and support that lower body. We're going to finish up with some hip bridges, or another also called glute bridges. You're going to take it to the mat. You can do this starting without any weight, feet about hip width apart, keeping those knees right over those feet. You're just going to push your heels through the ground, squeeze and lift, lifting your hips, squeezing your glutes and hamstrings at the top. And just squeeze and lower. Squeeze and lower. This is another way, another time when you can use that RNT, reactive neuromuscular training. Just tie that band around those knees. Help activate those glutes, keeping those knees from turning in towards each other. Push and squeeze. Push and squeeze. You can take a weight here, resting right there on your hip bones, not on your abdomen. Add a little bit more resistance along with the band. It's really going to fire those glutes and hamstrings, working on strengthening those muscles that will help support your knees. So again, depending on your situation, depending on your knee pain, check with your physician to make sure that you're cleared for exercise, and then try and incorporate some of these practices in your daily routine. You can perform these exercises, I would say 8 to 12 reps, 3 sets each. So give it a try, see what you can do. Have a great day.